It's Friday. We're going into a weekend with great weather, and I know so many of you are anxious to get back to the activities you enjoy, but you have some concerns about what's safe now that you've been fully vaccinated. Well, joining me to answer some of your questions is Dr. Charlene Wong with the North Carolina Department of Health and Human Services. Why is the scientific community saying not so fast when it comes to certain things?
Until enough people in North Carolina have had the opportunity to get vaccinated, and we're moving there very quickly. It's really important that, because we don't know, especially when we're in public, you don't know who else has been vaccinated or not, and so that's why it's so important to keep practicing those 3 W's.
Sitting outside on the beach, open space, but let's say it's Memorial Day weekend, a lot of people may be out.
This is a real encouraged to do, as long as, there's a lot of folks out, don't be packed in with a whole bunch of people. But if you're, with your folks that you live with, and particularly if it's maybe one other household, even if a few of those folks are unvaccinated, like children, for example, who are low risk, don't have, condition, definitely. Outdoor activities are safer activities.
Okay, sharing a beach house with people not in your immediate family.
If the other folks are vaccinated, definitely. The guidance is, if you are fully vaccinated, you can hang out indoors with other fully vaccinated folks, no masks on. That's going to be low risk. And in that case, if you're sharing a beach house, you will likely know, because you would ask, who's vaccinated in that household. If it's with folks who are unvaccinated, the guidance is okay to do it with one other household of unvaccinated folks, as long as none of those people have a high-risk condition.
Water park, splash park, public playground.
These are safer because they are outdoor settings.
Okay, Dr. Wong, this one's a lot of back and forth on this one. Dining inside a restaurant.
We do know it is one of those settings where there is higher risk that you might get or spread COVID-19. And so it's another one of those ones that you want to do really with precautions, meaning that you want to wear your face mask except for when you're eating, be spaced out still, wash your hands. And then I'll add here too, it's, as we're watching our different trends, if you know that where you live, your rates are really going up, or there's a big outbreak, it might be a thing, it might be a place where you really want to reconsider, do we want to eat out at a restaurant inside right now? Could we get an outdoor table? Could we do takeout?